the answer to any theory of everything is I don't believe in them, because a theory of everything is an attempt by a limited human, infinitely smaller than a speck in the cosmos, trying to explain everything. And the mother came in and said, "What?" and snapped at her and said, "What are you crying about?" And she said, "I'm crying about Daddy." And the mother inexplicably turned on a heel, and as she went out the door, she said to her, "If he'd sat on his knee, he would never have died." And, where does that come from? At age 16, she learned from an uncle that her father had died of suicide.
Welcome to the podcast that guides men to demystify and develop their intuition. I'm your host, Doug Beitz. Let's dig into the science and expand your horizons. My guest today is Dr. Brian Broom, often described as a story doctor or philosopher-physician. Brian has spent his career exploring whole-person approaches to health, driven by a deep dissatisfaction with the way body, mind, and spirit are separated in modern healthcare. He worked as a consultant physician in immunology at Auckland City Hospital, trained and practiced as a psychotherapist, working with people who have physical illness, and has maintained a lifelong interest in spirituality and meaning. Brian also developed and led the postgraduate mind-body healthcare diploma and master's program at AUT University in Auckland, and has extensive experience training and supervising clinicians. He's the author of 3 influential books on mind-body medicine, and is currently completing a new work exploring story, presence, and spirit in healthcare. In 2015, he was a finalist for the Senior New Zealander of the Year and received a Distinguished Service Award from the New Zealand Association of Psychotherapy. Dr. Brian, welcome to the podcast.
Thank you. Thank you.
Good. Looking forward to today because for a real long time, I have become aware from listening to a lot of different people that physical things that occur in our bodies that are very real, that we can look, see, and touch and feel, there is something wrong with someone's body, can often be caused by other things, their thoughts, by many other things like that. But usually the people whose story I hear, they've gone to a doctor. The doctor has sent them for many tests, given them medications, and nothing has helped, and no serious diagnosis was found. So somebody suggests they go to an alternate healer or something, and sometimes they get help from there, or they go to several, and their lives do improve. But here, for the first time, I'm hearing people are coming to you as a medical doctor, an immunologist with specialties, and you're suggesting to them that there's something more in their story of their life. So please share with us how this began and how you started to get into this field that's not been that common, but sounds very helpful and interesting to humanity.
Yes, I can do that. And maybe I'll do it briefly for a start and then expand on it as questions arise. I've always been interested in integration or putting things together. I like to look at the wider picture. I like to look over the boundaries of the way we ordinarily look. And I've been like that since a child, really, and certainly since being a teenager. Some of that was warranted because I was brought up in a very Christian and religious environment, which led to a kind of a clash as I emerged into university studies in science. So rather than being I'll go from one story to a completely different story, I started to look at how these things somehow spoke to the same much bigger reality of what we are. So there wasn't an easy way to do that. I was vocationally medical since the age of 8 or 9, and had decided that that was what I was going to be. An unexplained decision, really, because our family had no history of tertiary education. Anyway, that all happened, and I loved my medicine. I loved the challenge of it. I loved the clinical aspects, the finding out the causes of things and so on. It certainly appealed to me. But as time went by, I realized there were parts of me that were being kind of neglected. I was really more of an arts or a philosophical person than I was a scientist. I could do the latter reasonably well. And so that part of my life, and also the sort of the spiritual side, was kind of the sort of thing that you did in private on the side, and the rest of the week was a kind of secular challenge and an employment pivot of my reactivities. Anyway, in my late 30s, I decided to do something about this integration, and I chose to spend some years in psychiatry as a kind of segue into being with people in respect of their behaviour, their inner worlds, their minds, their thoughts, their troubles, and so on. And it was really interesting. But like the medicine that I was in, immunology and internal medicine, immunology being a subspecialty of internal medicine, the psychiatrists were heading headlong towards the brain. And so again, we were back with the body and with there's a lot of value in that, and I learned an enormous amount there, but I wasn't there really to become a psychiatrist. I was there to bring more bows to my quiver, if you like. And so I resigned from that and set up a centre. And the reason I tell you all that is that when I set up this centre, it was oriented towards horizon that we were hoping to approach was a serious professional integration of physical, it is the medical, the mental and emotional, which was there in the form of psychotherapy, and I became an established psychotherapist in the process, and the spiritual. And all of our staff, one way or another, had some kind of spiritual, Christian or religious background, and a commitment at some level. But just about all professionals these days find themselves, all those who are interested in wholes and whole persons, find themselves constrained by the scopes of the disciplines they've been trained in. Well, I was sitting there in my clinics now again, receiving immunological referrals from GPs and all sorts of people. And these people have real diseases. But I was there also wearing the hat of a psychotherapist. And I was starting to hear them say things that jolted me. They would tell me stories that somehow linked their physical appearance, their disease, their disorder, their dysfunction, with certain events in their lives. I'll tell you one simple one for a start. We can talk about more complex ones. I know this is a program for men, but the quicker one is to tell you about a lady. She was 72. She arrived, she had this terrible facial rash, and she'd had it for 5 years. And she had even had her liver biopsy because they thought it might have been an obscure tumour called the carcinoid tumour. But I think that was the desperation of the of the physician rather than a realistic option. So in the end, she was sent to me, and the question is, does she have an allergy? And I couldn't see allergy either in the presentation or in the mechanisms that might have been leading to this kind of presentation. So I said to her rather casually, not expecting a lot, I said, when did it begin? And she said, oh, it was 5 years ago. And I said, was there something happened 5 years ago? Oh, my husband got very depressed. And so this is about men, actually, if you like. Husband had got very depressed, and it turned out that he had been off and on depressed right through their marriage. She had been the stalwart, the stoic, and she was British and had a stiff upper lip, if you like. But he had 5 years previously, he'd got really ill, had ended up needing electric shock therapy. He was still very fragile, and her face was still rashy or severely red and inflamed. And I said, how has this affected you? And she said, oh, I keep a brave face on it. And I listened to that without saying anything. And we spent a little bit more time talking. Then I went back, how did you really feel about it? Oh, I keep a brave face on it. I said, you've said that twice. Do you think it might be connected? And she was a bit skeptical. She thought, oh, this wasn't what she understood going to a doctor was about. Anyway, I just explained some of my things that I had been observing with people, and anyway, I offered her an appointment, a follow-up appointment for it. I remember it 5 days later, I said, if you come back, we'll spend an hour just talking it through. We did, and that was the end of her brave face. I don't know what happened to the husband, but that was the end, something that had been going continuously for 5 years. Now, I can tell you stories of many kinds like that, some not as quick as that, some much harder to fathom and to work through. So I'm not saying it's easy. But
just to interrupt there, you're saying when she came back 5 days later, she had started to improve already?
No, she started to improve after we talked. She had never talked to anyone. You know, she's one of these stoical, private people who don't tell people her troubles. And he's got the trouble. He's the one I'm looking after. But who's looking after me, and who's attending to my needs? Who is hearing what I'm enduring and going through? And so
she put on that brave face, so she had held the energy of the circumstance in her face, literally, and it had manifested in a nasty rash.
Yeah, it was there for everyone plain to see, but it wasn't there for everyone to understand. Yeah. And what was needed at that point was someone to understand what it was like for her.
So that was her cry for help, physically manifestation, that people would be aware that she was going through something. Does that sound right, or
that's one interpretation. The reality was, I mean, I don't think underneath she's saying to herself, I need to cry for help, but I don't know what words to. If you think of these things as a representation of the trouble that she is in, and the representation is not usually expressed in words, because words are very good at getting things out, then where is she going to represent it? Where is she going to, and sometimes things get so powerful and they need to be represented, and the body is often the cause of the result of that, the body disturbance. I want to add one more thing there, which I think is implied by your question, and that is that who's she telling this about? Is she telling herself about it in the mirror? Or is it there for people to see if only they could see? Because the world or the everything, everything, everything we do and is, it's not the right word, and will do in the future is in some form or another relational. Someone ought to be noticing her. Someone ought to be caring for her. Someone ought to be seeing her. And the doctors come with a model in their mind that this must be some kind of inflammation. We've got taxonomies or diagnoses that fit inflammation, but they don't include meaning. They don't include the symbolics. They don't include storied truth, if you like. She's got a very powerful story that's manifested, and I've seen so many facial stories and other stories, of course, to know that many of our disorders have at least an element of the symbolic or meaning in them, and have played a part in triggering an illness, predisposing people to an illness, triggering it and perpetuating it.
Yeah. So how do your colleagues cope with your point of view on this sort of thing? Are you esteemed, or do they look at you and think that's a bit strange? But I guess at this stage of your career, like, you've got the runs on the board. Like, did you have issues with other medical doctors with these theories?
The answer is overall not really. One of the things that if you look at the alternative medicine practitioners, they tend to hive off and join another little club of kinesiology or nutritional medicine, and then they sort of hoist that up as a kind of the answer to human suffering. And of course, there's some value in some of these methodologies. So, but no system has all the truth, and a lot of systems don't have much of it. And that logic has to apply to mine as well. So the difference in me particularly is that the outcome of stories I've just told you is that I am very interested in the relations between illness, disease, and people's stories. Apart from all the other factors that might lead to, say, an arthritis, which is due to an HLA-27 gene or whatever, what I found was that often stories played in company of other factors that other physicians would see, such as genetic and other elements. So I embarked on a career, but I was still a serious immunologist, and look, without being too hubristic, I was regarded as a very good physician. And I maintained that reputation right through. And that was what people said of me. This man is a very good physician. And that was because I kept one leg on an ice floe. That was my medical thing, and the other leg on the other ice floe, and tried to keep the two ice floes joined together, though that's hard work. And sometimes it was better just to stick with one side or the other. But so I was integrating the best of what immunological medicine could bring to my patients with the best that I could bring of my understanding of stories and their roots to the same conditions. In terms of late in my career, when I was 64, we decamped from Christchurch to Auckland, to the end. I wasn't intending to take up practice again then, but I was invited by the immunologist at Auckland Hospital to join them. They knew exactly the kind of immunologist I was and welcomed me there. So, and that was again because I felt it was very important to be not so stupid as to dismiss ordinary medicine as having a crucial role in what happens in health today. But at the same time, I was going to challenge them, and did challenge them, to not dismiss the other things, the other side of the person. So when we don't look at the mind or emotions or relationships or trauma stories or meanings, often sitting there in full glare in the doctor's office, if only one has eyes to see and ears to hear. If you neglect those, you're, in my view, as culpable. This is idealism, of course, culpable of malpractice as you are of neglecting to do a chest X-ray in a person who's got a serious chronic cough. Because, the truth comes from all directions, and we are unitary beings, and it's just madness to think that the subjectivity side, and by that I mean the thinking side, the feeling side, the relational side, the intuitive side, the all the feelings association with abandonment, with abuse, all those things. To imagine that those things have nothing to do with the emergence of suffering in the body is what is in the lingo, is a profound form of dualism, keeping them both in separate compartments. And I think that is the Western problem.
Yeah. So the stories that you've heard from these countless patients through the years, I'm going to surmise, I'm curious, I'm going to suggest something, and I'm curious of what you observed. Were the stories these people telling always relational? Like it was some issue with their child, their spouse, their boss, their best friend. Did it just about always involve someone close to them and there was some emotional thing? What percentage of it would have fitted into that? That's what the story was really about.
I've never done an analysis of and how you do that. And how you would rate everything would be difficult, but let's try and put it several which ways. From first principles and from bottom up, dealing with patients, nearly everything I saw was relational. And in a funny sort of way, though, I'm anti-fundamentalist in the special sense of what I'm talking about. In a space sort of way, I would say that just about everything that came in front of me was relational. But that's in the widest sense. It might be, the woman who comes to me with a serious bowel condition of some kind, or rash of some kind, or breakout of inflamed running eyes. And the story is they've got 2 or 3 young children under the age of 3, and the husband goes off fishing every weekend, and her eyes flare after he goes, and they clear up if he comes back. And, that kind of stuff is just out there everywhere, uninterpreted. And, but, yeah, I suppose the question you're asking is are there some things that are never relational?
Did you have any? Do you recall any examples of where people's story didn't involve people that were close to them?
I think so. I think of a woman who got a rather uncommon condition called cold urticaria. She was a farmer down south in New Zealand, and she had this rather quaint history of she'd always lived near the beach, and summer and winter, she would go swimming. Being out in the water was her a kind of a symbol of belonging, if you like. It was part of her identity. It was what she did. It's what she loved. It's what things got siphoned into, if you like. And but she, yeah, they had a big flood, terrible weather event down south. And these days they seem to be having them everywhere through New Zealand, right through the summer. But anyway, this is quite a few years ago. And they got this big flood, and they found themselves swimming their cows to safety and being up to her neck, and the cows being up to their necks and swimming. And it was a cold weather system, so it was very cold water, and they survived it. But the outcome over the next few days was an inflammatory condition that only occurs when it's cold. Cold urticaria you can diagnose it if people are getting it, because you can put a lump of ice on their arm and it'll come up in a huge welt. Not just the usual red mark, but a huge swelling. And so she had cold urticaria. And of course, if you think about that woman, it was the cosmos that was letting her down. The ocean had never let her down. But this flood had come in and encroached onto her life and destroyed some of her livestock. It had threatened her life and livelihood and so on. So, the symbolism there is a relationship to the land, to her own existence, to what is her identity and how, blah, 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 that kind of stuff. So I think you've got to interpret a relationship on a very wide scale. And individualism has been one of those kind of huge strengths of Western society, but we've lost a lot of that. So when I think of a person, I don't think of them as an individual so much, though there is an individual aspect to it. I also think of a person's are constituted in relationship. They become meaningful to other people because they're there. This little person that was born yesterday is not just a fetus. It's a little person. Who does she look like? I wonder how she's going to turn out. I wonder, we wonder so much. So a person is constituted in relationship, and we're sustained in relationship. No matter, there are some of us do pretty well with some isolation. I'm one of those. Or solitude is perhaps what I like, not so much isolation. But and others just can't get enough relating and socializing, and in that nice way of being together and sharing lives together. So I think your question, if I might put it this way, suggests that there might be a theory of everything in here. The answer to to any theory of everything is I don't believe in them, because a theory of everything is an attempt by a limited human, infinitely smaller than a speck in the cosmos, trying to explain everything. And I think theories of everything are dangerous. But I look around and I think, oh, that philosopher's got some really interesting things to say. That's useful to integrate it. When he goes on and gets disciples, and he wants them to all say that and more about that, then I think that's become a school of thought which needs tackling at some level, but not ruling out. You do rule out some things because they're basically fundamentally evil or bad, but we've got to be a bit humble around the mysteries of life.
Mysteries.
I seem to be talking a lot.
No, you're right. You're right. You got it. And mystery is very, very true. So I'm curious, with all you've seen with people with illnesses that, physical, or they're brought on by their emotional state or whatever, what knowledge intuitively have you taken from all that to keep yourself, and I'm going to use the word in tune, very loose word, probably not the correct word, to keep yourself centered, to keep yourself from going down one of those paths to having a rash, a whatever, a disease? What do you do daily that you could recommend to the listeners to help keep yourself centered, grounded, whatever that's the correct term there?
Yeah, that's a lovely question, and it brings the sort of interface of my work with my own life into profile. Well, let's start where will I start without getting too voluble? The first thing I would start with is that we're not alone in a very fundamental sense. Now, what I mean by that is that we're born into a world that is relational, and what I've learned in my work and felt in my work is that in putting aside my cleverness or my now quite extensive knowledge at the door, going in without my quiver of skills, and I'm talking symbolically here, and going in and being with the other and being open to what is, but being able to stand back from it and come forward at the same time. That leads to, firstly, a sense within me that of stability. I don't need to rush in and fix or change. I can be with something and let it. So there's a still point that I honed and practiced in my work with people, where I would. I'd like to. I guess I'd like to tell a story about that. That might be the best way to do it. I'll tell you two stories. I'm going to tell you two stories, because talking about an abstraction tends to words tend to fight each other, and I can't decide which is the best one to use. So let me go back. When I was a medical student, I had a Christian Protestant background, and our family was a nice family. There were five boys. We had the utmost freedom during the week. We lived on the Christchurch Airport as it is now, but in those days it was sort of wartime Herwood Aerodrome type place, and we had 40 acres and shingle pits filled with water and aeroplanes everywhere, and we had the right to walk through the hangars. There were no key cards or keys or anyone, anyone was allowed to get in or go out and even climb into the old planes if they were sitting there waiting to be dismantled. And so there was a lot of freedom and a lot of exploration and very little formatting of behaviours. We didn't have any systematic sport, which I regret. We didn't have, and as long as we behaved ourselves and didn't get into crime, we were fine as far as my mother was concerned. And so, but at the same time, we belonged to this Christian church, and we got a lot of teaching about the Bible and the gospel and so on. And by the time I got to medical school and I was getting into the sort of integration of stuff, I kind of took a dive on that and thought, I don't know, I'm not sure I know what all this is about. And it wasn't one. Some of my friends sort of dumped it and went off and did join some other kind of temporary stable for meaning of life, but I didn't do that. But I struggled with it, and I didn't know where I was at. And I think the first step that happened for me was that I stopped trying to know for certain. It wasn't a very pleasant place, actually, but and I was home from medical school, and there was a little hut out the back which had been created for me when I was pre-medical to do study in, and just a little. They used to transport cars and boxes in those days on ships, and anyway, my father built out of one of these boxes and built a little study for me to get ready for medical school. And so I was sitting in this hut home on holiday, and I picked up this book, which there were a whole lot of books from my grandfather's place there on the shelves of this little hut. And it was a religious book, a theological book. And I was sick of all of that. But anyway, I picked it up and read a couple of pages and came across a verse that I knew very well. But only in abstract. My analytic mind had been going flat out for the last 10 years, and really it hadn't delivered much in the form of inner comfort. And I read it again, and you probably don't know it, but behold, I stand at the door and knock. If anyone hears my voice and opens the door, I will come into them and sup with them. And something happened there, and something changed. And I felt that something real really had happened. It was strange. I put the book away. I never read it again. I went up and out of the hut, and from that time, I think I knew that there was some kind of givenness in reality, some kind of presence, some type of willingness, accompaniment, if you like, something. One can interpret it any way we like, but I realized that was probably the beginning of a sense that I could knock on the door of people's lives as I had been knocked on, not with any theology and not with any idiom, Christian idiom, but there was some kind of inner sense of stability around being with myself. That was the first feeling, and being confident that there was something that I was not alone in, and I could be. And I think that sat underneath my struggles over the years in a way that I never ever spoke of to the patients. I wasn't there to. I was there to be with them, to, if they opened the door, come in and sup with them and join with them. And I learned that, that healing often occurs in that framework. That people, they might bring all sorts of their own idiom in, and that's true, but deep down inside there's something that they feel that resonates with that, and I feel. So being curiously not knowing, which was the state I went into in that hut, not knowing for a year or two, not knowing where I'm going. If there's something there, something will have to happen, if you like. I have found it a lot easier than a lot of my clinicians that are trained to hope and expect something more. And in fact, my wife was talking about it yesterday. Even when I'm not seeing patients, that's how I operate. And, with this talk, I don't know where it's going to go. Don't have any fixed outcome for it. I just know that if any of these things that I say or have learned have meaning for somebody, they'll go somewhere and they'll take it somewhere. And there's something true and beautiful about that. I'm not in control of it. I don't have to manage it. I'll tell you another story, how this works out. I had a woman, and this is really one of my most fascinating stories, just written up in my new book in detail. But this woman was 57, and she came to me with, it was referred to me by a psychotherapist, actually, with a nasty condition of the mouth called leukoplakia. Now, leukoplakia is a pre-cancerous condition, and as a result, she had had 7 major surgeries to her mouth because of the cancer that had arisen. And this was over about 20 years. And in the most recent episode, they had excised half her tongue, and she had taken it. She was a professional woman working as a school counsellor, but she had taken 2 years of speech training to get back to her work because of her speech. So this was serious stuff, and I'm not a cancer doctor. So, and I said, well, what are you wanting? And a bit surprised that I was being asked, actually. And out of scope, as you would say, in the modern world. And she said, well, I said to my husband last night, if only I could get rid of it, I'd have peace of mind. Everyone listening to that would probably say, well, of course you would. 20 years of leukoplakia with cancer, if you could get rid of it, you'd have peace of mind. But there was something about the it. If only I could get rid of it. And I stored it in my mind. I thought, what? Is there something about this it? Anyway, I didn't know where to start, so I suggested she start at the beginning, and she started exactly by telling me that her parents were unhappy, and they conceived her as an attempt to bond themselves together. That was patently unsuccessful because the legend was that on the day he brought his wife and daughter home from the nurse or the hospital, he dropped them at home and went off to see his mistress. At age 5 or 6, her father died, and he died away from home, and she was not told the cause of the death. The mother became alcoholic, and at age 12, she was in her bedroom crying, and the mother came in and said, "What?" and snapped at her and said, "What are you crying about?" And she said, "I'm crying about Daddy." And the mother inexplicably turned on a heel, and as she went out the door, she said to her, "If he'd sat on his knee, he would never have died." And, where does that come from? At age 16, she learned from an uncle that her father had died of suicide. She then went on to marry a military man who was serially unfaithful, like her father. And at this stage, she had 2 children by then. She divorced him, and at this stage, I was wondering where I was going. I didn't know what was happening. So I said to her, "So when did it all start?" And she said, "Oh, I know when it was." And I said, "What do you mean?" "Oh, I was 32. And I said, "Well, is that important?" She said, "I think it might be. I've always wondered." The father died when he was 32, and the father was a dentist. And here she has a disease that started, blamed on her for not sitting on his knee, started at age 32 in her mouth, and her father's a dentist. So I goosebumps up my spine, and I said to her, not knowing where to go next. This is really a story about not knowing where to go next, actually. And I said, at the beginning, you said something about if you could get rid of it. And I know it's the tremor and tremorous tendency. Is there anything else? And she started to cry, and she cried for about 5 minutes, which is a long time in an office. And at the end, she said, "I can't get hold of it. I can't get hold of it." And then she said, "It's the shame of having caused my father's death." So what do you do with it? I suggested that I said, "I don't know where I'm going. I don't know whether I can help, but we can explore together." We spent 6 or 7 sessions, and she came in on one of those late sessions and said, "I've had a dream." And I don't usually ask for dreams. They sometimes come up, but I wasn't expecting one. And the dream seemed to raise the question as to whether she had really sat on her father's knee or not. And which seems totally implausible from my point of view. But even if he was a bad father, I can't imagine him not having on a knee at some stage. But anyway, at the end of the session, she suddenly said, "I think I can see him sitting on my knee." She thought she could remember. We finished the session and she drove out, and the next week she came back to see me, and she was a changed woman. I said, what's happened? She said, well, when I drove out of that session down the driveway past the building, she said, I felt this huge joy. She said, I'm now able to talk in meetings. I've never found it easy to talk in meetings. And this joy went on for about a month. And then she visited her plastic surgeon who had done all the surgeries over the years. And he looked into her mouth and he looked at her, she said, and he said, what's happened? He said, you don't have any other condition. And it had gone. It had gone. And it has not come back over the last 18 years. I've followed her up. Now, what does that tell you about me in terms of what I think? How do I cope with? I think I, I keep a sense of hope alive for everybody. Um, I, I, I have an expectation that even in the ordinary things in life, even in the ordinary words, there are things subtended or subterranean to them. That intuition is not about knowing primarily; it's about a movement inside you, a kind of. It is a kind of knowing. It's not the knowing that demands mastery. It's not the knowing that requires clipped logical reasoning. You are in the real world with real people. You don't know what can happen next, but if you are there with an open heart and a willing heart and a generous heart, things happen. You say things and you hear later, I heard you say once, I can even never remember what it was. Yeah, I just think, and I think there is a kind of inner eye of faith, really, that there's so much more. These days it's fashionable, according to Ian McGilchrist, for us to all shift from the left to the right brain. That went out of fashion, it's come back again. Look, I think that's true at a point. I think it's true that when we operate more and more out of the right brain, as it were, that is a representation of a lot of things I've just been telling you. Um, that's a long story, but that's the kind of stuff that reflects me, I think.
Mm. Well, excellent. My internet connection hasn't been wonderful for the last couple of minutes, and I've been getting a message to say it's at my end. But the way I'm recording, I'm confident that everything that you're saying has come through clear and been recorded well.
Okay.
So I'm hoping you can hear me fine right now, can you?
Yeah, I can hear you. Yes, the picture isn't as good as it was.
Yeah, no worries. All right. So the audio's fine. One last thing I wanted to ask you, and it's really unrelated to what we've been talking about, but it is, I guess, in with the theme of what you've been talking about with the patients that you've seen through your lifetime. I'm just curious, putting it back on you now, because I have many fears in my life that I've recognized, and I know there's a lot that I have yet to recognize, but I'm just curious, what's your greatest fear? Without being too personal here, without being too, but just in general, just to help be relational, I guess, to the men that are listening, because we all have fears, and I think it helps us when we hear what other men go through as well.
Yeah. I think I think the greatest is probably not easy for me to say. To put it, I think I do fear my own innate capacity to go back and to try and control things. So I don't tend to learn that and I am very good at doing practical and technological and all those kinds of things. So my fear is that in being good at doing those things, that I allow them too much play, and then I sort of have to be mastering things in a way that is damaging. I don't think at an ordinary level, my greatest fear as I'm aging is that I might not be able to read, or I might not be able to talk. I would hate that, and that's a kind of very basic physical level. I've been very fortunate up to now, but I am aging.
It was interesting there. The screen's freezing in certain little spots and then slowly moving. When you were talking there for a moment about fear, it froze with your hand right at the base of your throat, which is like, obviously it was starting to like get you. It was like, oh, what am I feeling here? Because I know myself, I can get like that, or my wife does. When we start to get a little bit thinking of our fears, the hand sort of goes to there. So I'm sorry if I've taken you to that point, but
no,
it's very real for all of us.
I don't mind at all, really. I mean, I have the ordinary fears of we have a little boat, and my daughter wants to take it over, and I was kind of wanting to empower her in that, because I don't want it any longer, and my fear would be that she wouldn't have the wherewithal and the understanding and so on. So that fear has been assuaged now because she did a boatmaster course and she now sees what's involved, and she's very keen to be trained. So, yeah, there are kind of ordinary fears like that. Yeah, and I think that, I mean, I value solitude. I don't want to be alone. And as I've got older, I realized that with colleagues, I'm very busy on Zoom with colleagues and so on, but if something should happen to my wife, I'm going to have to face that, and I'm doing it already, joining groups and so on, so that I realize the usefulness of what it is to be, or not usefulness, the joy of being in company and also having my own solitude. Yeah, just little things like that. I don't have a great fear. At this point, I don't fear dying. I think I've seen plenty of death and been through the most horrid death of a family, and that is the death of my daughter at 42, age 40. And after a long illness, and that was the most challenging part of my career, actually. So I know I can get through. The other thing about going through this pathway of feeling things, learning to be not knowing in that specialized way that I have, discovering that the world is enormously complex, and had a good look into medicine, a good look into psychotherapy, a good look into my own forms of spirituality. I realized that none of us can govern all that, but we can go through it. And even under the worst of circumstances, we can find a way. And one of my new chapters in my new book is Finding a Way Through, and that is an account of my daughter's illness and how I particularly we had a pilgrimage to get through the grief of that and the challenges of that. So, I kind of feel, and that was 13 years ago, I kind of feel now I could cope with most things. I'm not really, I feel like there's been a blessing in it all. I've got some coping skills and understanding of the world that are not totally shocked and when something goes wrong. And so, I don't know, I'm wondering there. I don't know whether that might help anyone else, but
that's great. And I'm curious now, your new book, is it weeks, months, years away? What's the timeline with that?
The written aspects of it are finished. I've got it out to selected readers to give me feedback on it, and if they like endorsements. Once I've got those, I'll submit it to a publisher. So sharing I can get.
So will it go typically on Amazon, things like that, where people could access it?
Well, I hope so. I mean, most books do now these days. My first approach is to get it to a good publisher. And my other books have had London publishers, so there's a track record there. But we'll see. It is very full of things that I haven't touched in my other books. People might like. I think if people are interested in what I've said in some form, one way for them to get to that would be to go to the website, which is a free website. There's even a self-help tool there. There's no money. There's no requirement except not hope that you might, or you or anyone listening, might get some benefit from it. But lots of clinicians and lots of patients have found themselves thinking about a lot from that website. It's in manageable language. There's an illness explorer there, so you can even put yourself through that and see where you fit in terms of the things that we've been talking about today.
Excellent. All right. So
it's called www, whole person, which is one word, .healthcare, one word, www.wholeperson.healthcare.
Okay, so we'll have that in the show notes so people, they can go in there and they'll be able to click on that link.
Yeah.
So we'll have that and any other informational links in there as well. So apart from that, is there anything that we haven't talked about that you'd like to cover before we wind up?
Yes, I do. I do want to say some things. As most men know, and most people know, there's been a kind of struggle and a stigma around what they used to call psychosomatic conditions. And which, though I've used the term now, it, generally speaking, never goes out of my mouth. But because people may be familiar with it, what that term, traditionally has meant is that if it's psychosomatic, it's not a real disease. It's you're doing it to yourself, and at worst, you're wasting the doctor's time, or you need to get your head right, or you're a nutter, or any of those awful things that have become associated with what it means to even look at the subjective or emotional, spiritual, mind side of illness. Because I'm a holist, that is, I see persons as wholes. I don't divide the story off to the right and the body off to the left. They're all in there together. And if you've got a doctor who kind of won't entertain anything but a germ or a cancer or a stroke or anything, and everything else is not worth thinking about, then you're with the wrong doctor. Or you might be with him, the right one, if it's a cancer that needs cutting out and you need his technical expertise. So I would say to men that I'm very strongly of the view that the stigma associated with psychosomatic disorders is based on a false underlying theory that mind and body are compartmentalized. They're not. It's not true. And secondly, one doesn't have to swallow the whole story, because behind a lot of physical illnesses, they're partly driven by feelings that are not acknowledged. And they're nearly always adverse feelings, negative feelings, anger or fear or feelings of abandonment, or you go on and on and on, pride and selfishness, but they're stories, and the stories are full of feelings. And this is why women often get better care in this whole story. You mentioned earlier that a lot of my stories are about women. Well, it's true. Women will more easily acknowledge their feelings. Men are often afraid of feelings, maybe out of touch with their feelings, or have a limited range of feelings, and to be invited to just take time out and consider other feelings without feeling put down or worse, is quite important. So what I'm really saying is, your physical condition may relate to something, quite a simple story, and you might get a quick fix. On the other hand, your story might be a long one, and it might require a journey for you. And if you're not prepared to go on the journey, and a lot of people are not, they're prepared to suffer. They're more prepared to actually put up the side effects of medications, even if they don't work, than they are to actually face those aspects of themselves. I think that's a male error. There are women like that too, of course, but proportionately the men suffer more for that reason.
Yeah. No, I hear that, and I think that was a good way to wind it up, to give the men something to think about, that if there's something physically wrong with them, it might be from whatever, but it potentially could be from something, an emotion, a feeling, whatever they've held in. And so it's time, guys, to get in touch with those inner feelings and listen to your body, it's et cetera, et cetera. And I'm no philosopher on this, but I get it, but I don't explain it that well. That's why I have people like you on, Dr. Brian. So, yeah. Thank you for that. We've been going for nearly an hour and a quarter now, so I think we've probably got the message across in the way you share it, which is wonderful. I've really enjoyed it. And for a long time, I've thought this way, and it's just wonderful to hear the depth of your understanding. Because when you go to alternate people who try alternate things that do sometimes work, they don't have the depth of the understanding and the longevity that you bring. So thank you very much for that.
You're very welcome. And a pleasure.
Thank you. All right. And to all the men listening, go into the show notes, and look at Dr. Brian's website and his links and sign up in there somewhere to be alerted when this new book comes out. Thank you.
Okay, Doug, that's good.
Well, we're at the end of another thought-provoking episode. Remember to subscribe so you'll be alerted to new episodes. I want to say thank you to the men who are joining me on this journey of intuitive development. I truly hope our time together has expanded your reality and reinforced trust in your ever-reliable gut feeling. Embrace your intuition. It will not lead you astray. Until next time, stay tuned, stay curious, and trust your gut.